Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Welcome to Ask the Doc. I'm Kathy Buccio. Now, today it's all about men's health and self-care with some sports-related medical advice. We're going to throw that in for good measure. We have Dr. Madeline Camejo. She's the Chief Pharmacy Officer for Baptist Health. And welcome to Dr. Brandon Welch. He is the Clinical Sports Wellness Coordinator also at Baptist Health. And they're standing by ready to answer your questions. So on this episode of Ask the Doc, let's get started. Welcome to Ask the Doc. It's the show where we encourage our viewers to send in all their health questions. And today's first question comes from Nathan, who just reached out to us through our website, allhealthtv.com. So Nathan's question is, hey, Doc, I'm 55 years old and I've gained some weight recently. I've also been unusually fatigued and not that motivated to do anything lately. And I mean anything. Does this mean I have low T or low testosterone? What are the most common symptoms? And if it is low T, what can I do to get it back to normal? So what's the deal, Dr. C? Are we talking low T here?
So Nathan, as you can see, I would not be quick to jump to assumptions because sometimes that you have low testosterone. Because there are other medical conditions that kind of have the same similar symptoms and like an underactive thyroid or other autoimmune conditions. But some of the symptoms you mentioned are indicators of possible low T. Now, fatigue, not interested in doing things, weight gain, loss in sexual drive, then it's time to have a conversation with your primary care physician to do the blood work, investigate, and see what is the true underlying condition or issue. And if it is low T, then you can get put on a medication regimen.
Thank you, Dr. Camejo. Now, heads up, we have a YouTube question from Matt. And Matt asks, hey, Dr. Camejo, I love running marathons and I'm currently training for my next one, but I recently started getting muscle cramps in my legs, or more specifically, my calf muscles. Is there anything I can take for this? Maybe some vitamins or supplements? So I've always wondered about what causes these muscle cramps that we often get. So Dr. Camejo, what do you think?
Well, hi, Matt. Thanks for reaching out to us with your question. I think I'm going to let the rookie come off the bench this time and get some playing time. Brandon, you've got this one.
Matt, great question. The majority of muscle cramps I see in our athletes are a result of not getting the right amount of electrolytes to support the sport they participate in. My general rule of thumb is choosing a sports drink that contains sodium, chloride, potassium, and magnesium, and at least 6 to 8% of carbohydrates in our sports drinks. These are key elements that keep our muscles firing and hydrated during intense workouts to prevent muscle cramps. Now, a few sports drinks that I typically recommend that contain these key electrolytes to prevent muscle cramps. Gatorlyte, rapid rehydration beverage, is a great option to consider. And then also sticking to our good old-fashioned sports Pedialyte is another good option to choose from. Sometimes with sports drinks, it can be trial and error with finding the right one that works best for you. But ensuring those key electrolytes that are in your sports drinks are my staple in preventing and limiting the amount of muscle cramps. Another option to consider, if sports drinks aren't the most accessible, especially for my endurance runners and my weekend warriors, I like to recommend the electrolyte gels, which are very handy and accessible option to use during a long race.
Dr. Welch, let me ask you, can you talk a little more about these electrolyte gels? How are they used?
So yeah, they're nice, quick and easy gels. They come in a gel form, exactly what the type is. And I mean, you can buy them at any sports center. So you can get it at like a Dick's Sporting Good. And typically I see a lot of our runners keep it in like the little fanny packs when they're doing any of their half a marathon, marathons, or 10K races. And it's something you can just, on the go, just pull it out. It's a quick gel you put inside of your mouth. And it's full of all those different key electrolytes that I mentioned to help delay or prevent muscle cramps. Very easy and accessible. I know sometimes with hydration drinks, you got to stop, take off the cap, pour it into your mouth to drink it. But the electrolyte gels, they're very quick, accessible, and handy.
Thank you for that, Dr. Welch. Now we have another allhealthtv.com question. I love this. It's from Marshall, and he asked, "Hey, Dr. Camejo, I've been having a real tough time getting to sleep lately, and I've tried over-the-counter products such as melatonin, doxylamine, please correct me if I did not say that correctly, and valerian root. My doctor said that he'd be happy to put me on Ambien, but I'm a little concerned about the potential side effects. What are your thoughts on Ambien, and is there anything else I can take to help me get some C's?" Okay, so we all know sleep is the foundation of our health, but when you can't get that sleep, that is very bothersome. So what do you have for Marshall?
So Marshall, sleep is really important. And so Ambien comes with several side effects. Like most medication, it also depends on the person and how well they tolerate the medication. But common side effects do include headaches, drowsiness, and sometimes a small incidence of sleepwalking. People have been known to sleepwalk with Ambien. But Ambien is a popular option for insomnia, but there are other sleep agents out there as well. There's another sleep agent called Rameliton, which is a prescription and mimics the actual action of our natural producing hormone melatonin to help keep and promote sleep. And this medication really has minimal side effects and works just as well as Ambien. But again, you can also consider using over-the-counter supplements like melatonin, which it sounds like you are doing so, and also the doxyloxamine, which is the Unisom, and it is a sedating, what I call a sedating antihistamine, but it's not long-term solution. So as your body develops tolerance, it works less. So the important thing is really talk to your provider and decide what's best for you.
Let's send in those questions. And we actually have our first Instagram question, and it comes to us from Mallory. And she wants to know, Dr. Camejo, my son Jason is 15 years old and he plays soccer. His coach would like to see him build up his muscles, but he's having a tough time doing it. He's about 5'8", weighs 120 pounds. Are there any supplements that you recommend to help him build a muscle? So this is a really great question. So how can you build muscle when you're as thin as Jason?
Well, that is a good question, Mallory. And moms and soccer moms worry about that all the time. How do you put a little bit more muscles on their boys? But I would think I'm going to pass the baton to my favorite sports pharmacist, which is Brandon, who actually treats many athletes with this condition.
Mallory, good question. So whey protein powder is a great place to start. Whey protein is one of the most highly researched supplements when it comes to building muscle and strength. It's rich in what's called our branched chain amino acids, which are essential for muscle building properties and strength. As we age, our muscles tend to shrink and carry more water weight, and it places a larger emphasis in making sure we are getting enough high quality protein from our diet or supplementation. Now, wait, I got options for my vegetarian and vegan athletes as well, who prefer more plant-based products. Just make sure you are choosing a plant-based protein powder that is rich in those branched chain amino acids, leucine, isoleucine, and valine. These are both great protein powders, blends, options to put inside of your morning smoothies as a breakfast meal or after a good post-workout snack. I'm a big fan of the brand Garden of Life Sports Whey Protein, and they also have a plant-based option as well. Also, adding creatine powder. This is a naturally occurring amino acid, which has plenty of research and evidence to support muscle building properties and has the benefits of improving cognition and focus. So you get a 2-for-1. My general rule of thumb when it comes to how much protein a young athlete like Jason may need to help build muscle is anywhere between 1 to 1.2 grams per pound of weight. So just in case for your son Jason, who was 120 pounds, I would say anywhere roughly between 120 to 144 pounds a day of protein. And for creatine powder, I typically recommend anywhere between 3 to 5 grams daily, and it blends perfectly together. So you can have your whey protein and your creatine powder together inside of a smoothie.
Dr. Welch, should everyone be taking whey protein or creatine if they want to build muscle, especially as we age, or is this mostly for athletes?
I think it's a great option for both. I mean, as we age, just for your general population, our muscles tend to break down. And so it requires more high quality protein. And so whey protein, because it's rich in those key 3 branched chain amino acids, it really helps, again, build some of those muscle defining properties, which are really key to help building muscle and strength.
Great fact. So heads up, we have a YouTube question from Antoine, and he asked, Dr. Camejo, I've been kind of down the past few months. First, I lost my job, and then my cousin, who I was very close to, passed away. My doctor wants to put me on some antidepressants. I'm not big on the whole drug thing, and if I'm being honest, I'm a little worried about them causing issues in the bedroom, if you know what I mean. Dr. Camejo, what can I do to make sure that this doesn't happen? Now, I'm not a doctor, but I think I know what Antoine means here.
And yes, and Kathy, I think I do as well. And Anton, if your doctor thinks you need to get help during this time period, I can tell you that not all antidepressants are created equally. Side effects are common with antidepressants, both in men and women. So your concern is completely understandable. And side effects do include a change in your sexual, drive, erectile problems, orgasm problems, even problems with arousal or satisfaction. But the severity of the side effects depends on the individual and the specific type, and sometimes the dose of the antidepressant. Some people, sexual side effects are minor and may ease up as their body gets adjusted to the medication, but sometimes they don't. So antidepressants, kind of with the lowest rate of sexual side effects, would include something like Wellbutrin, Remeron, Viibryd, or even Trintellix. Now, if you're taking an antidepressant that does cause side effects, your doctor may have some strategies for you, something like waiting several weeks to see if it gets better as your body tolerates the medication. He may have to readjust the dose to reduce the sexual side effects, maybe switching you to another antidepressant, or adding medications to help improve sexual function like Viagra or Cialis. So the most important thing is really work with your doctor to find an effective antidepressant or a combination of medications that will reduce your sexual side effects, but will also help keep your depression under control. And that's the most important issue to look at.
Absolutely. Thank you, Dr. Camejo. We got a really interesting question here from Facebook. It's from Elijah, who asked, hey, Dr. Camejo, my mom loves Ask the Doc and said I should email you. I play midfield on my college soccer team and was recently diagnosed with a stress fracture in my tibia. I'm going through physical therapy, but still in a lot of pain. I was told by the athletic trainer to avoid NSAIDs, which I sometimes take after games because they help a lot with muscle cramps. But what can I take for pain now? And should I be taking calcium or something for my bones? Dr. Camejo and Dr. Welch, what can Elijah take for the pain? This is such a great question. And I think he has a question about calcium, which is a really good one too.
So yeah, Elijah, I'm sorry to hear you're in pain, but let's see what we can get you on to get you back on that field. But Elijah, what studies do show that NSAIDs like ibuprofen or Motrin needs to be avoided when you have a stress fracture because it will interfere with the natural healing properties of bone. And that really can delay healing of the fracture. Now, Brandon, I know you use a particular protocol in clinic with your athletes. What would you be recommending here?
So, yeah, I usually recommend my athletes to stick to Tylenol or acetaminophen and follow what's called the PRICE protocol, which is protection, which is rest, which is ice, compression, and elevation. And I'll go through the few. Protection is meant to prevent further injuries. For example, an injured leg or foot may be protected by limiting or avoiding weight bearing through the use of maybe crutches, a cane, hiking poles. Partially immobilizing the injured area by using a sling splint or brace may also be a means of protection. Rest, R, is important to allow for healing. However, many sports medicine specialists use the term what's called relative rest, meaning rest that allows for healing but is not so restrictive that recovery is compromised or slowed. A person should avoid activities that stress the injured area to the point of pain or that may slow or prevent healing. Ice. Ice is recommended with the intent to minimize and reduce swelling as well as to decreasing the pain. There are many ways to employ what's called cryotherapy at home. The most common and most convenient is a simple plastic bag of crushed ice placed over a paper towel or cloth on the affected area. It's important to protect the skin and limit the cold exposure to 10 to 15 minutes. Cycles of 10 to 15 minutes on and 1 to 2 hours off are generally agreed upon as effective and safer than longer periods of continuous ice application. Now for C, compression. The use of a compression wrap, such as an elastic bandage, to apply an external force to the injured tissue. This compression minimizes the swelling, which you can sometimes get from stress fractures, and provides mild support. Now, lastly, when it comes to elevation, we want to elevate the site of injury. It's recommended to help reduce the pulling of fluid sometimes that we get from these stress fractures in the injured extremity or joint. Controlling swelling can help decrease the pain and may limit the loss of range of motion, possibly speeding up the recovery time. Because, hey, Elijah, we want to see you back on the field as fast as possible. Elevation is accomplished by positioning the injured area above the level of the heart. Elevation is mostly best during the walking hours, if possible, positioning the injured limb on extra pillows. I typically recommend, too, for my younger athletes who get stress fractures, get a wedge-shaped pillow for sleep. It's probably one of the most effective things you could do. They sell it on Amazon. And to answer your second question, when it comes to calcium, yes, absolutely, you are right. Making sure you're getting enough calcium and vitamin D are essential to help strengthen your bones and to prevent stress fractures. Vitamin D is very common vitamin that we see deficient in a lot of our athletes. And fun fact, when it comes to vitamin D, that a lot of people are not aware of, is that vitamin D is also a hormone. And so it also helps support healthy muscle as well and good immune support. So, hey, you're getting a 2-for-1. My general recommendation for young and growing athletes is 800 to 1,000 milligrams of calcium carbonate in divided doses and anywhere between 1,000 to 2,000 international units of vitamin D.
Lots of fantastic info there, Dr. Welch. Thank you for that. Okay, so it looks like we got another question from the gram. This time it's from Clyde. Howdy, Dr. Camejo. Cancer runs in my family, both men and women. This has obviously got me a little concerned, especially now that I'm out of the I'll live forever phase. I'd like to know what types of cancers are most prominent in men and what's the best way to reduce my risk. Dr. Camejo, that's an important question from Clyde. What do you say?
I think, Kathy, you're right. Clyde, that's a great question. And it is a typical one as well. Men are notorious for not being proactive about their health, and as they should be. But some of the cancers that are most commonly affect men are prostate, colorectal, lung, bladder, and skin cancers. Knowing about these cancers and what you can do to help prevent may also help save your life. And the best thing is always go to your doctor, get screening tests. You know, we don't do that enough, especially sometimes women either, but start screening, go and getting done screening tests. And once you've done that, the other thing is the best way to really reduce your risk is, number one, maintain a healthy weight. Do exercise regularly. I would say 3, don't smoke, use tobacco products. That all leads to cancer. Eat a healthy diet. Limit your alcohol. Don't go out drinking all the time. Protect yourself from the sun with sunscreen. We don't do that enough, especially down here in South Florida. We get a lot of direct rays, and we're exposed a lot to sun all day long. And and I would say the last thing is really protect yourself from sexually transmitted disease, STDs. Wear protection. That's really important because that also leads to a lot of cancers as well.
Now, this question is from Laurencio, who reached out to us on allhelptv.com. So you should really check the website out, everyone, when you get a chance, because it really is full of such valuable information. So Laurencio's question is, Doctor, I'm 62-year-old male and was recently diagnosed with erectile dysfunction. This has never been a problem before, so I went to a urologist who prescribed tadalafil. It works, but my heart beats faster, which makes me a little dizzy, and then I end up with a nasty headache. Are there any natural options I can take that'll help me keep me in the game without the side effects? So doctors, what can we do to help Laurencio?
Lorenzo, sorry you're dealing with this. And unfortunately, yes, one of the side effects of tadalafil can be headaches, which is why I often recommend as my first solution is to make sure you are staying well hydrated while on this medication. Now, to get into more lifestyle-related options that can be contributing to your problem, making sure you're getting adequate sleep. So anywhere between 7 to 9 hours is important for healthy testosterone production. So poor sleep has been highly linked to erectile dysfunction. Also, if you have cardiovascular disease, this is a risk factor that increases the risk of erectile dysfunction. Heart disease reduces blood flow and may contribute to easily 50 to 60% of the cases of erectile dysfunction. Make sure we are eating a heart-healthy diet, such as the Mediterranean diet can help reduce your risk for heart disease and a handful of cases that we see in erectile dysfunction. Now, if we want to look at some dietary supplement options, there's been some very good research on this supplement called Tribulus terrestris, which is a herbal supplement used in traditional Chinese medicine to improve sexual dysfunction. It's rich in more than 70 healthy compounds to help support the male reproductive system. The typical recommended dose is 500 to 750 milligrams of Tribulus terrestris. And of course, always check with your local pharmacist to make sure that there's no drug interactions with the supplement.
Thank you so much, Dr. Welch. Well, I mean, we had some more questions, and I'm so happy to have so many of you send in questions to Ask the Doc. They'll be back next week. But I just want to say thank you for joining us. Dr. Camejo, Dr. Welch, thank you again for providing all your knowledge and information to all these fantastic questions. And that's all the time that we have for today, folks. I'm Kathy Buccio. Remember, send in those questions. We cannot wait to see you next time. And I'll see you on Ask the Doc next week.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.